Hi, good afternoon. I am Dr. Analea Adorable Yazon to answer your questions on how to get that picture perfect smile. The first question is it better to brush my teeth harder and will it make my teeth cleaner? Brushing your teeth harder will not make your teeth cleaner. Below the hard outer shell of your teeth called enamel is a softer area called dentine. Over time, the outer enamel layer gets thinner with brushing, also with aging, and more of the yellowish dentine shows through. It is best to use a soft bristled toothbrush with moderate pressure while brushing, and don't forget to floss in between your teeth. Next question is, how can I lighten my teeth color at home? Teeth whitening is a simple process. Whitening products contain bleaches like hydrogen peroxide and carbamide peroxide. These ingredients break stains into smaller pieces, which makes the color less concentrated and your teeth look brighter. Whitening toothpastes, they come in different brands in the market. They typically contain mild abrasives like baking soda. These abrasives polish and remove surface stains. They also contain low concentrations of hydrogen peroxide to bleach the teeth. Whitening strips, on the other hand, are one of the most effective over-the-counter teeth whiteners. As the active ingredient, hydrogen peroxide is left on the tooth surface over an extended period of time. Whitening pens contain also the active ingredient hydrogen peroxide in a pen or gel form. You glide over your teeth to whiten them. Whitening kits. Most whitening kits, they contain a plastic tray or a mold, which is used to apply the bleaching agent. It's either hydrogen peroxide or carbamide peroxide directly onto your teeth. Then a blue LED light is held over the tray. This increases penetration and accelerates results. Like the teeth whitening strips, light devices are very effective because of the amount of time the active ingredient makes full contact with your teeth. For the whitening toothpastes, pens, or gels, they offer minimal to moderate whitening results due to the lower levels of bleaching ingredients, whereas the strips, trays, and light devices, they can provide a more dramatic result since the whitening ingredients make full contact with your teeth for a longer period of time. Charcoal products are common in the market today. We can see them in toothpaste form or in jar form, but I just want to tell you that activated charcoal is not proven to be safe or effective for teeth whitening. The ADA, or American Dental Association, has not given it its seal of acceptance, which certifies a treatment is safe to use and is recommended by dentists. Not only charcoal has not been proven safe, but it might also damage your teeth. So before you use any DIY teeth whitening methods, you should first talk to your dentist about which options are best for you. If you want quicker and more dramatic results that can go up to 10 shades lighter, it is best to get professional teeth whitening at your dentist's office. Although teeth whitening is safe, there are still some risks that you should know. Tooth sensitivity and gum inflammation are two of the most common side effects of teeth whitening. Also, teeth whitening is mostly recommended for patients with good oral hygiene. If you have cavities, gum disease, or any other oral health condition, you must refrain from using whitening products. Next question is, are there any products that we should know about that will help us take better care of our oral health? Taking good care of your oral hygiene is essential to your overall well-being. So there are really a lot of products in the market today, and these are the two most useful products that I would recommend. For patients with braces, crowns, bridges, and implants, a water flosser can help remove food particles from your teeth and may help reduce bleeding and gum disease. This can also aid in reduction of bacteria below the gum line, which is hard to reach, but remember that this is not considered a substitute for brushing and flossing. Keep in mind that water flossers are only an adjunct to brushing and flossing. If you only use water flossers and don't brush and floss, you can still get cavities in between your teeth. Using a tongue cleaner or scraping your tongue can remove harmful bacteria that causes gum inflammation as well as prevent cavities. Most people often neglect cleaning their tongue, so please clean your tongue as often as you brush your teeth. Next question is, how can I strengthen my teeth now so I don't lose them when I get old? Basically, brushing and flossing are everyday ways to keep your teeth bright, white, and healthy. So you should remember these 3 tips. First, of course, practice good oral hygiene at home. Brush your teeth for 2 minutes, twice daily. Floss at least once a day, and clean or scrape your tongue to remove bacteria. 2, eat a balanced diet. High fiber foods lower the acid level in our mouth. Leafy vegetables and crunchy fruits such as apples and pears, they generate more saliva in our mouth and can scrub our teeth clean. Now, if you are having anything sweet, soft, and sticky, make sure to drink a lot of water to wash away the sugars from your teeth. Lastly, visit your dentist. Have regular dental checkups and cleanings twice a year or every 6 months. And lastly, one of the most common questions I've been getting lately is, Doc, is it safe to visit your dentist during the pandemic? Oral health is just as important as healthcare for other parts of your body, but it gets sidelined most of the time for some reason. So I will tell you that yes, you should visit your dentist even during COVID, especially if you suspect a problem or if you are experiencing any symptoms. COVID should not be a reason to cancel an upcoming appointment. Prompt care is crucial for a healthy smile. And dentists have always practiced impeccable hygiene habits, even before the pandemic. Wearing gloves, masks, eyewear, protective eyewear was always part of our job. Although clinics now may have up or infection control and disinfection practices, dental offices have always been a germ-free zone. Studies show very low COVID transmission rates, so this proves that our healthy habits work. Regardless of the pandemic, your dentist will still and always provide you with the highest level of care. So if you have any problems or concerns, consult your dentist. If you are a bit hesitant to go out and visit your dentist, you can call, do a teleconsult, or send a message. And for sure, your dentist will assure you that it is safe to visit the clinic even during the pandemic. I hope I was able to answer a few of your questions. Thank you so much for listening.